My name's Gaj Panagoda. I'm a doctor specialised in general paediatrics and paediatric rehabilitation medicine. And in that role currently, I'm the CEO of Xstitch Health, which is a not-for-profit organisation that works on improving health systems for underprivileged communities. Yeah, I've had quite a variable, interesting journey in medicine. So I think I had a fairly conventional sort of start, and probably important to know that your background always influences what you decide to do. And I'm from central west New South Wales and grew up in a rural area, and then basically did physio, wanted to go into medicine, and then went on to that up here in Brisbane. And from there, really got exploring. So worked up in Townsville for a few years, through Western Queensland, doing those sort of single doctor, challenging relief jobs in little remote hospitals. And then came back to Brisbane for specialty training in general paediatrics and paediatric rehabilitation. And even within that, was really fortunate to have some excellent mentors. And I was able to do rotations which are different to the norm, including in the community for adult rehabilitation, and also spending a terrific, amazing, challenging 6 months up in the Kimberleys, which involved a fair few newborn retrievals with the Royal Flying Doctors. So really got to see a lot of the country, meet a lot of people, and it's probably been one of the greatest memories of my career so far. We're a really early not-for-profit, which is exciting. The idea really started from my experience working across various different communities and systems, including the public and the private and the not-for-profit sector. Importantly, a lot of work in the Indigenous sector as well. And I really saw that there is untapped strength in communities when we normally look at underprivileged communities as having problems or challenges only. I found that a lot of those communities actually had strengths and should and could be involved in really harnessing their own healthcare journeys. The team at Xstitch Health is quite diverse. We're quite different to a normal sort of healthcare setup. Our strength is very much in things like change management, policy, governance, monitoring, and we really look towards doing something a little different to just putting doctors in front of patients. We look at the whole system as one, and of course those clinical services are important, but that's just a smaller part of what we will be doing. The current model is based on projects. So this is a fairly unique way to describe a model and fund it in health at the moment. So we are looking to work with communities that have got defined issues or challenges. If it's not defined, part of the project is to find that. And then we decide on what are the deliverables that community needs and how long will that take. So if it was, say, a 12-month project, we would say at the end of that 12 months you will have this deliverable and this is the overall cost of the project. Most of the interest so far for this model has come from schools. So they are schools that work with in underprivileged areas of the country. They're also schools that provide services for students with particular needs. And the reason I think that school systems are interested in this is because they want to work better with health systems. And the current system where the teacher maybe can tell the parent that their child should see the GP potentially, it's just too unreliable and slow when for some of the quite acute issues that the schools face. So that's a key area, and the interest, to be honest, has been a lot stronger from there than what I expected, but it's reassuring. I think there is untapped potential in medical specialists in Australia. Once we've seen a couple of thousand patients, I think we intrinsically know what is needed on a wider scale for meeting the needs and the issues of those patients that we see. And at the moment, we aren't really tapping into that. And I don't think we need to wait until you are, say, a department director or a hospital executive to start actioning some of that collective knowledge. On top of that, from my conversation with specialists so far, I've really got the impression that doctors want to be able to have a bigger impact rather than doing the one-to-one patient consultations as their sole job. So this is a really important part of Xstitch Health, and I think it will only grow in importance because I expect that we will be able to offer what is at the end of the day a new kind of job for a doctor. So it could be something along the lines of being in your clinic and seeing patients in your clinic, but then the other half of the day is completely dedicated to system improvement that will also help manage those patients. Now, medical specialists aren't usually taught this in medical training, and that's the role of Xstitch Health, to try and use the resources that we've got in the team when it's on us to support you to be able to learn and deliver that bigger picture impact. With that kind of job also, it comes with other differences, such as there will probably be options around sort of working in various locations. The idea of a project-based job means your outcomes are very clear that you need to deliver, and we're getting away from that endless waiting list kind of scenario, which is really challenging to manage, especially if you're going to have some career progression. The post-COVID environment really showed that the public system, the hospital and health system, really can't do all the heavy lifting. It also showed that community-based systems can be really innovative, and that's where the opportunity is now, really. And communities are, I think, now deserve a different kind of model of health and expect it in that environment. And that's really where the 6 pillars of Xstitch come together. So we are really trying to start with working with the communities to identify their strengths and challenges. We then will collaborate with stakeholders to develop their processes and systems. Based on that, we decide what's needed. So that might involve creating resources and other services needed, and part of that might be health professional services. And it's very important that health professional services are actually lower down the list, because we don't want that to be our default management strategy. It's also important to understand that the fundamental role of medical specialists in communities is different to hospitals. And so we need to have a system to support those health professionals to do their job to the best of their ability. And that's also an important part of the business. And to wrap it all up, we have the community voice informing all of those earlier pillars as well. My real hope for this model is that we achieve something that can be easily applied across Australia. And that would be regardless of location, cultural background and funding situation and so on. The collaborative model has a lot of strength. And I think building a collaborative model from the ground up is a unique offering, rather than deciding to bolt on the collaboration once the model is already built. The other really exciting part about our not-for-profit is the potential to create a new kind of socially conscious, inspired, community-informed medical specialist. I believe that this is where the future of medical specialty care lies. There will always be the important roles in the hospital, but there is plenty of excellent, interesting, fun work to be done out in the community by medical specialists, but it is important that we don't just bring a hospital model into the community. And that's where we hope to really be able to support those medical specialists to really work to the top of their licence and have a big impact in the community.